We leave you tonight on the front lines of a medical revolution in East Africa. That's where a Canadian charity is using a small handheld device to save lives. CTV's medical specialist, Avis Favreau, explains.
And here's an example of an x-ray we took.
X-rays, MRIs, and ultrasounds are tools we take for granted in Canada, but they're hard to find in rural Uganda. A fact this Canadian doctor wants to change using this ultrasound scanner that connects to an iPhone or iPad.
You can basically bring it with you anywhere into a really remote rural area. And then again, it just plugs into the device, you pop it on the patient, and it's a single probe rather than 3. So it makes it that much easier to diagnose.
William Cherniak is an emergency doctor who volunteers in Africa. He set up a charity called Bridge to Health. One of its goals, to connect high technology like the scanner to rural clinics in Uganda. And his charity helps train healthcare workers there how to use the device to diagnose life-threatening conditions like pneumonia.
They'll have this clinical officer in a village being able to scan them right then and there when they present to care. And that can mean the difference between life and death for some people.
Images are then uploaded to specialists in North America, like Michelle Lee at Toronto's Hospital for Sick Children, for a second opinion.
Is this just a viral illness? Does it look like a bacterial pneumonia? Or is this a very significant disease that would require transfer to a higher level of care?
The hope is that in time, the $2,000 device could be used to diagnose many other critical conditions in other parts of Africa, Asia, and South America, with a Canadian charity helping deliver this high-tech healthcare to the poorest regions of the world. Avis Favreau, CTV News, Toronto.